And as one of the founding members, I really would like to express the gratitude for this arrangement here and for the support. It's very important. And I'm also very happy to bring to you the aspects of education, which I think is the future, really. And it's a challenge to set the stage of education for future dentists that are also going to be facing not only the challenges of today, but also facing the challenges of tomorrow. I will let you through a little to know about the Association for Dental Education in Europe, but I also would like to then face the issues, how we're going to change, because I think education is the foundation for the change of practice. The ADE is not a youngster anymore. It was founded in '75, and it is an independent and non-profitable European organization to represent all academic dentistry and dental education in both community and in Europe. And I'm really happy to say that it's about over 80% of dental schools that are represented by our association. And we also have connections, of course, worldwide, and also with sister membership both in North and South America, Australia, and Russian Federation. So we have a vision. We need a vision. We need a vision that by assuring and improving the quality of dental education across Europe and beyond, actually, it's a worldwide issue here, raise the quality of oral health and dental care provided by our communities, and actually to the benefit of our patients. That's actually the end result we would like to reach. Last year, ADE took the motto, which you see in the bottom here, learning together to improve oral health and quality of life, which I think is all what we're doing here today. That's very small. I hope you can read that, but that's the missions really stating that we do have an issue of talking about convergence towards higher standards in education. We are spread out, we have different cultures, we have different traditions in education, so this is a task in itself, but we can also learn from each other and not really persisting on doing one uniform program. We want to promote, coordinate the peer review and quality assurance, which we have been doing through the dental program, I will mention a little bit later on. We'd also would like to promote, because how do we know that we do actually good quality education? That is through the assessment and the examinations and the quality of them. We also would like, of course, to increase exchange, because through the exchange of both teachers and students, we improve and we open our eyes and can find different solutions. How do we disseminate our knowledge and understanding? We are very proud of having European Journal of Dental Education, which is reaching out internationally. It has a very good standard, and that is our window to the world. And what we're doing today, we also want to provide a link between other bodies that are interested in education and health. I need a little here, the mouth. I'm doing research in dry mouth, so I know the reactions here. Anyway. As you probably know, Association of Dental Education has been supported by the EU basically since 1997. So change does not come easily. You really have to work on a long-term basis. The support that the association has had has been really to find means by how we can harmonize dental education in Europe. It was a challenge when it started out, but it has been based upon really self-evaluation of a lot of dental schools in Europe, coming to some sort of consensus of what we think is important in education. And as you can see here, we have been founded in, first of all, in 3 different periods, with 3 years apart, with 3 years sections here. And the dented 3, as you see, that finalized in 27, ended up really with the most important document that we have in the association, and that's the profile and competence document, which really states and is the first one European curriculum. Also, as you can see, we are working further on the competence of continuing education, which was actually finalized this month here. So how do we work? I think it's important for an educational organization to work on different levels. We work on guiding documents, we work on the institutional level, on the educators level, and of course we are including corporate members that will support our cause. And not to forget the students. We are here for the students, and we want to make them the future dentists with the high quality education. And as you can see there, that our action really evolves around task force structures, we have workshop, we have special interest group, and our annual meetings, and that's where all this takes place. I think what is important to think about is that we are going through really a paradigm shift in oral health education. We are moving away from disease management to disease prevention and health management. And that will be set out in all the curricula that we see all over Europe. But it is a challenge. To help out with this, the Profile and Competence for European Dentists was actually launched. And in this competence document, we can find the guidelines for actually finding out the level and competence of the graduating dentists that will be able to encounter all the different dilemmas and the situations in the general professional practice. In this document, you can find 7 domains that you can see here, and today we are approaching the domains of 6 and 7 there, which is again showing the shift towards going for prevention and health promotion. In this document, you will find both major competencies that ADE believes should be taken up at all dental schools in Europe, and there are also going to be supporting competencies that can be chosen by the institution. We have difficulties, I would say, but also I think something that we can gain from that we are doing different depending on culture, depending on traditions in education, depending on the politics and so forth. Another document that we are very proud of is that to be able to fulfill the profile of competence, you also need support on the methods of learning and teaching. And if we want to promote mobility of our students and later on mobility of our dentists, we really have to start in our education programs. And that's why you're also supporting the ECTS, and this document really describes that. And again, there is more to say about education. It's to prepare for the future, we really have to have the evidence for oral health research today, but it has to be in translation with also what the evidence we have about higher education. And I would like to highlight this article that is approaching this in evidence-based oral health care and research in curriculum. It is a position paper, I would say, that is worthwhile to include in this strategy. I will give you an example how the education has shifted from the time when in the older days of dental education, that we do have the force for clinical science knowledge, that you cannot stand alone. You need incorporation of other sciences as well. But it has to be on the basis what we would like to achieve. We would like to achieve students that are good in finding health-promoting strategies. We need students and dentists that are good at being exposed to novel situations and being good in diagnosing, and then prevention and treatment. And as you can see here, we need support from both medical disciplines, behavioral science, and social sciences. An example that we have had is that, you know, you all have feelings here. I think a lot of you, if you're a little bit older, you have a lot of feelings. And maybe we could have prevented all the feelings by approaching it from a point of view that we are really forcing prevention. And there was a working group taking up this in 2010, and where you're actually shifting over operative treatment instead of being a preventive treatment. And this, you can see, was really successfully addressed in this workshop. The proposal that was given from this workshop, I think, is worth mentioning here and actually doing a sort of sum of what has been said earlier today here too. Students in their program need to take part in community dental health activities. They need to be out in schools, nursery homes, and really see the effect of what they have been taught within the dental schools. We need integration of epidemiological indices already when students learn how to take charts and really find the evidence for how they have the underlining of their education. Curriculum, we need to as we said before, include epidemiology, healthcare system, and healthcare economics, and also cooperation with medicine, health, sociology. And I think also we have to look upon the integration of courses with other healthcare professionals, actually to gain the benefit from the practice. And also, again, I think we need support to be in the education from public health sector, from national health sector, and insurance companies. I would like, because I think this is really warm greeting, our students are doing a good job. This is from the EDSA, European Dental Student Association, that are taking on an outreach program in Kashmir in India, where they are actually promoting to find ways of educating the local population, both for primary care. But what they found out was that they need to come back many other years because they have to work for the long-term health approach. So there's a lot of education involved in this as well. So the suggestion for future actions, I think, what can we do? We can support the movement of interprofessional education and practice. We can support and advise in oral health. We can support implementation of decisions related to oral health. And I think also, which is mentioned before here, that we should gather data from the work that we do in dental schools and from educators. And this is important, the systematic follow-up of the actions that we have been taking. And also support development of technology, because we haven't mentioned there is an enormous amount of evidence out there that we can use new techniques, especially, for instance, saliva diagnostic, to improve the disease risk management. And also, I think we organize working groups to explore pathways for advancement of oral health. So, educating for a smiling Europe, I think in all the context that we should do that. And thank you very much for the attention.